Hi, how you doing today? My name is Cesar Lee, I'm from snu-therapy. We're here today with Negus Webster-Chan, and he came in today with a hip flexor strain. What happened, Negus?
Just playing basketball in Hawaii. Came down awkwardly, and then it's just been hurting since.
Okay, so you came down awkwardly from a jump shot, right? And you pretty much just landed on the one leg?
Yeah.
Okay, so what it sounds like, he's got a bit of a hip flexor strain. So once we dig in, right in through there, you can tell he's in a little bit of pain, so that's where the strain is, right in through here. Okay? Now one of the main techniques that we use here at snu-therapy is called passive release techniques. So it's basically putting the muscle from a shortened position and then lengthening it passively. There's no point in doing it actively when the muscle's already strained. So what we're trying to do is we're trying to relax the muscle. So the more we do it passively, the more the muscle starts to relax. Okay, Negus? Next thing, you get Negus to lie on the side. So Negus, can you get your face in the camera for me, please? Here, just get you to lean back so your butt's in my hip. Awesome. So we're gonna do the same thing. Then you get Negus to bring his knee all the way to his chest. You're gonna bring it all the way down, and then you're gonna wrap it around there, all right? Ready? Next thing, you have him lying on his stomach. So usually when the hip flexor is affected, he'll be in a forward flexion position like this, just because he's trying to muscle guard the hip flexor. So a lot of the times, the low back muscles right in through here, as well as the glutes, are going to try to pull him back into position. Okay, so what we're going to try to do, same thing, passive release techniques is going to try to release some of the muscles around the area. Okay. We're going to take a look at his Q wells right in through here. So same thing, it's going to be a little tight just because he's in a forward flex position. Right over here, right buddy? He's actually got a knot in through there, so what we're going to do is we're just going to hold on to that knot until it says to release. Any shooting pain, buddy?
No.
Good. Alright. Can you get you sitting up for me, Negus? Just face the window there. Awesome. You give yourself a big hug. Good stuff. So same thing. We're going to start to release some of his erectors. So I'm going to get him in a short position, and I'm going to passively move him forward and down. Alright. Then we're going to hit his QLs. Same thing. I'm just going to go straight back. We're just going to go all the way down. Alright. Most important thing for him after treatment is to stretch his hip flexors just so it doesn't go back to that shortened position. After 2 or 3 treatments, he should be back on the court playing. So just to recap, the pain is in his hip flexor, but just because it's in his hip flexor doesn't mean his other structures around the area are going to be affected as well. So other areas to look out for are his TFL, his QL, and his erectors, as well as his glutes. I'm Cesar Lee from snu-therapy. Again, if you want to get some passive release techniques done, only done at snu-therapy. Come by and see us.